This work package is all about investigating physical capability. And physical capability is the capacity to undertake the physical tasks of daily living. It impacts on the quality of life and may also be related to later health and disease risk. Now, most aspects of physical capability show a rapid rise in the early years of life, reach a peak in early or mid-adult life, and then gradually decline as we age. So the level of physical capability in older adulthood is influenced by both the peak that we achieve and the rate of decline, so may be influenced by risk factors from across the whole of the life course. So some of these factors will influence the level of the peak, and others will influence when and how we decline. There are different ways of measuring physical capability, and in the HALCyon cohorts we've used simple objective tests. So we've looked at hand grip strength, walking speed, a chair rise test, which times how long it takes people to rise from a chair and sit down again a number of times, and a balance test, which records how long people can maintain balance on one leg. The main purpose of the research that's planned for this work package is to understand how risk factors from across the whole of life influence physical capability at older ages. So we'll add to the existing knowledge by carrying out comparable analyses across multiple cohorts and by conducting systematic reviews to establish which factors are robustly associated with physical capability. The main research questions being addressed in this work package are: first, how do physical capability levels vary by age and gender? Second, how are risk factors such as lifetime socioeconomic conditions, childhood growth, adult body size, health status, physical activity and childhood cognition, how are these related to physical capability? And finally, do the age-related declines in physical and cognitive capability occur together?
We've so far addressed a number of the main research questions. Firstly, to assess whether the objective measures of physical capability, including grip strength and walking speed, that we focus on within this work package really are useful markers of ageing. We've looked at whether these measures are linked to subsequent health. We reviewed the published literature and contacted study investigators and identified 33 studies across the world that had looked at the link between grip strength, walking speed, chair rising ability or standing balance performance and survival. We found that those people, older people living in the community who performed better in these tests were more likely to live for longer than those people who performed less well. We also found some evidence to suggest that those people who perform most well in these simple physical tests have lower risk of subsequent bone fracture, cognitive decline, cardiovascular disease and hospitalisation, although there was a clear need for further research on this. The other major strand of our work has been to begin examining the lifetime risk factors of physical capability across the HALCyon cohorts. Early work has confirmed that in the UK, as in other countries, that physical capability levels decline with age and that men tend to have higher physical capability levels than women. We've also shown that childhood socioeconomic disadvantage is consistently linked to lower levels of physical capability in adulthood across the HALCyon cohorts and in another 11 studies from around the world. For chair rising and walking speed, this relationship wasn't fully explained by the tracking of disadvantage from childhood to adulthood. We've therefore been examining in depth within individual studies the pathways which may explain these associations. In the next year, we will continue to investigate potential lifetime risk factors of physical capability. Work has already begun to examine whether taller or heavier people have better or worse physical capability levels than shorter and lighter people. We also plan to look at whether weight change across adulthood is linked to physical capability and whether size at birth and infant growth are influential. Other work will investigate whether physical capability levels are influenced by health status and physical activity across adulthood. For example, do people who exercise more across adulthood have better physical capability levels than those people who are inactive? Another strand of our work will be to investigate whether physical and cognitive capability are linked. The likely impact of our research is to highlight the importance of physical capability, especially in ageing populations. Because we are looking across multiple cohorts, we hope to provide robust evidence of the factors across life that influence physical capability.